Addressing knee pain does not need to be nearly as complicated as it's made out to be. We can overcomplicate it by thinking all of these biomechanics, which are extremely valid, but we also need to realize that our fascia, which is our main connective tissue, is what is pulling and torquing the knee out of alignment. And then the bones can't articulate properly. And that's where, yes, biomechanics comes into play. But we need to first off release the fascia. And some people can just release the fascia and then their body can kind of figure out how to self-organize, and then their knee pain literally goes away. Other people need a little bit more of an in-depth approach, and I'm going to be showing you, in addition to these fascia decompression techniques, this one specific exercise, and I'm going to cue you very detailed on how to do this properly to start rebuilding this connection all the way from the foot, the knee, the hip, and the glute. So let's get started. All you're going to need is a rolled up towel or a block from Block Therapy. Where we're going to address the fascia today is going to be more in the lateral band, and this can be from the IT band. This is where the TFL ties in, also to the IT band into the peroneals. That also can affect into the foot and up the chain as well. But I've really noticed that working in some of these areas can really help take tension off of the knee, because if these 2 points get tight, it can cause more knee valgus, where the knee tends to cave and dump inwards. So releasing this is very powerful. Now, of course, you can release in many different areas, and it's not necessarily a one-step approach for absolutely everyone, but this may be the ticket to really help your knee starting to function more effectively, your foot relationship to your knee, and your hip as well. So let's grab your rolled up towel or your block. I'll show this with the towel. We're going to start on the IT band, which is more on the outside portion of the thigh. This also can glue into your vastus lateralis, which is the outside portion of your quad, and that can also take a lot of the hit as well. So we are just going to have the towel like this. The towel's pretty nice because it's not as dense as the block, and this can be a pretty intense area to work. But we're going to work a little bit closer towards the knee. You can, of course, on your own time, work this entire band. And we're going to get comfortable on our side. You can stay up on your elbow, or you can even just bring yourself flat to the floor like this. And the first thing we want to do is connect to our breath. I want you to try to exhale of 6 counts, inhale of 4 counts, and just really slow and controlled breathing in and out through your nose. That's going to trigger a little bit more of a parasympathetic state, which is going to help us relax so our fascia just doesn't continue to tighten up. We want it to release. If you want more pressure, you can bring that opposite leg on top of the leg that we're working, and you're just going to hang out here and just focus on breathing and finding these areas of tension. There might be tension absolutely everywhere. And we're just going to be spending about 3 to 5 minutes in each position. If you are wanting to search for other areas, the slower you move, the better. I don't want you to be rocking back and forth or doing anything quick with your knee, but a great thing that you can do is very slowly and intentionally, we're just going to be straightening one knee at a time, like this, in one direction. And that's going to help create a little bit more glide of the fascia as we're going in with this external tool to help release and rehydrate our fascia. That's what we're really trying to do, is find these adhesions that are torquing and pulling the knee out of alignment so that we can just go back to functioning properly. And this is going to also help us to rewire the way that our lower body should be more structured. So once you spend about 3 to 5 minutes, then all we're going to do is bring this just below the knee. So we're working above and below. So we're addressing these 2 points. And then you can bring the opposite leg on top again. If this isn't that intense, the block will definitely get deeper. And I like working a little bit higher up in the lateral calf area. And we're going to be spending, again, 3 to 5 minutes here. You can slowly do some movements. You can even move your foot around and do some ankle cars if that's something that you're interested in. And then once you've spent that time here, nice and slow, we're going to exhale up and off. Now, if this is bothering you just on the one knee, then you can focus just on the one knee. If you need to do both, of course, you can do this on both sides. But now I'm gonna show you this exercise that pairs so well with this to help create a powerful connection all the way from the foot into the glute. Now we're moving on to the exercise, and this is such an important exercise that we can actually nail down, and we've all probably done this before. It's a variation of a split squat, which looks similar to a lunge, but it will be an isometric. Isometrics are incredibly important for rebuilding tendon health, for strengthening and stabilizing your fascia, and creating more of a neurological connection between our foot to our knee, to our hip, and our glute. So I'm gonna stand up here. I might be cut off in my head, but just really we wanna be focusing on what's going on about here down. Now the first thing is we're gonna take a step back. When we do this, we wanna make sure that the foot isn't directly behind the front foot. We want them in alignment with our hips, just like we're walking throughout the gait cycle. And next, once we're about this distance away, just find that ratio depending on your height. The first thing I want you to do is push forwards with this back leg. Not a lot of people bring awareness to the back leg, but we need that for propulsion to push us out of a given side. So as I get to my toes here, I want you to feel the calf, the hamstring, but also the glute is pushing you over slightly to the right like this. That is step one. It's really making sure the back leg is actually engaged. Now, we're gonna stay up a little bit higher. We're not necessarily gonna be getting lower because depending on what kind of pain you are in, I don't want you to be feeling pain as we're doing this exercise, so just go as low as you can. Now for the front foot and the front leg, let's bring awareness to the foot contacts. Ball of the big toe, the inner heel, and the fifth metatarsal head. So it's that point right there. We don't want the foot to be collapsing in or overly supinating like that. We want to feel grounded on the floor. Now, once we're here and we feel that the left leg is engaging, it should be pushing us forward slightly. We need to just resist that slightly. So let's feel that right side is starting to engage. You might feel the quad, the glute. Make sure that the foot is making contact with the floor. And now what I want us to do is to hinge forward slightly. This is so important because first of all, many people try to stay upright and there's a time and a place to do that. But if our pelvis is tipped forward slightly right now, we don't want to just come upright by creating more extension in the back. We want to be able to hinge forwards and feel the glute opening up and creating more internal rotation space in the back part of the hip. Look what even happens to my knee here. If I am more upright compared to hinging forwards, the knee tracks backwards slightly, which is good. We don't need the knee to be going over top of the toes or past the toes by any means in this exercise. So let's stay up about here. And now, as the back leg's engaged, we're feeling the foot contact. Now we're feeling the glute. Let's bring awareness to our pelvis. Many people will have one hip higher than the other when we're doing this. Try to make sure that it's a little bit more level. So I'll give you more of a visual here. What's gonna help prevent that is engaging that back leg, that glute, that fascial connection. And then from here, almost try to push into the floor with this front leg to bring that opposite part of the hip up a little bit higher, and that's gonna light the glute on fire a little bit more. Now, if we don't have enough internal rotation space in our hip and our glutes aren't working well enough, the knee might be taking the hit. So we wanna create this connection all the way up. So just feel that for yourself, right? I'm doing this and I'm pushing in. That glute is bringing me a little bit more square, if not pointing slightly towards my lead leg. And we're gonna be holding this for about 8 to 10 breaths if you can. Once you've done about 8 to 10 breaths, you might only be able to get 5. You might only be able to get 3, and that's okay. At any point, if there's pain, ease off and don't get as low. Just stay a little bit higher up like this. That's totally fine. And then over time, as you get a little bit lower, we're still engaging that back leg and it's still gonna be bringing us forwards, and we're gonna be stabilizing this with that front leg. A good way to structure this throughout the day is make sure that you get the fascia decompression in first. That is so important because that's releasing adhesions. It's creating more of a window of opportunity to start building more of a connection from all the way from your foot, all the way to your hip and your glute, which is so important. Really, the knee's not doing a whole lot here. Yes, we want to strengthen it, but we got to make sure that the foot is communicating well with the hip as well. Once you've completed the fascia decompression, then you're gonna start getting right into that variation of a split squat, holding it for 8 to 10 breaths, doing about 2 to 3 sets if you can. Perform this once to 3 times per day, and then again you're going to start noticing some pretty incredible changes. But make sure that you rewatch some of this to make sure you're getting the proper cueing, because it is all in how you perform and execute this split squat. Anyways, thank you so much for tuning in. We'll see you in the next video.